Okay, chapter 23 are your spirochetes. We're only going to talk about 2 organisms in this chapter, and one you're already very familiar with. That is your Treponema pallidum that causes syphilis. We'll also talk about Borrelia, which causes relapsing fever and Lyme disease. So these are helical-shaped motile bacteria, so they're spiral-shaped bacteria. Borrelia, it causes relapsing fever. So what we see is in Borrelia recurrentis, we see bouts of fever, and then the fever will go away, and then it will come back, and then it will go away, and it will come back. And this will recur over and over again. It is a louse-borne infection. And it is typically seen in overcrowded areas in Africa, Middle East, and Asia. So here we see high fever with shaking chills, delirium, muscle aches, very rarely fatal, but difficult to suffer through. So here's the Borrelia recurrentis, spiral-shaped rods. Borrelia burgdorferi causes Lyme disease. It was discovered in Lyme, Connecticut. It's spread by the bite of the Exodus tick, and we usually see it most often up in the northeast area of the country between June and September. That's during the life cycle of these deer ticks. And it's some conspiracist theories believe that the government released these infected ticks into the country themselves because there's some kind of laboratory up there on some small island where the government was doing experiments on animals, and somehow this disease broke out from that laboratory, and the government has infected us all. But I don't know if you're involved in all those conspiracy theories, but think about that. Protective clothing and repellents are your best way to prevent infection with Lyme disease. So basically you've got 3 stages of the infection. In the first stage you see this typical bullseye rash wherever the organism bit the human. So we have a central zone that is clear, maybe swelled a little bit, and then the outer zone is very red. In stage 2, it's when dissemination occurs and the organism spreads from the bite to somewhere else in the body. Stage 3 is the chronic form where we have skin lesions, neurological symptoms, arthritis. That's when the organism has spread to other parts of the body, and it sort of prefers certain spots like the brain and joints, and so that's why we see the arthritis and neurological symptoms. Very difficult to get rid of if it's not treated fast. So detection is generally, we screen people with symptoms and very high risk factors. So maybe they live in an area that is endemic with Lyme disease. The dark fluorescence detection is the easiest way to do it with spirochetes in the blood, or dark fluorescent microscopy. Cultures, very difficult and only successful in very early stages. And we use Kelly's medium to culture for Borrelia burgdorferi. And then PCR is being developed. It's more sensitive and specific, but very expensive. The treponemes, or Treponema pallidum, is the organism we'll talk about in this genus. It causes syphilis, and the transmission is through sexual contact, injection, direct contact with lesions, transplacental transmission. Some virulence factors is that the organism is able to penetrate intact mucous membranes, so there doesn't need to be a lesion there. It's able to cross the placenta. It's able to disseminate throughout the body into other organ systems. And it does have antigenic variation. So the surface of the antigens on the surface of the organism can change, which helps it to evade the immune system. The incubation period is about 3 to 90 days. So it allows the organism to disseminate throughout the body from where it was first infected. In primary syphilis, we see a canker at the infection site. Usually there's one, but there can be several of these, especially in HIV-positive individuals. The base of the canker contains the spirochetes that can be identified, so you want to target the base when you are collecting the specimen or when the nurse is collecting the specimen. And then you want to perform the dark field microscopy or immunofluorescence or serology. In secondary syphilis, this begins about 2 to 8 weeks after the canker appears. We see a widespread rash on the palms and the soles of the feet. We can see some systemic symptoms like lymphadenopathy, fever, headache, malaise, and sometimes some aseptic meningitis. In latent syphilis, in early latent phase, about 4 years, initial 4 years relapses occur. The patient is infectious during this time. In the late phase of the latent phase, this can occur for an indefinite duration, and sometimes no complications ever happen. During this latent phase, the only way we can detect the Treponema pallidum is through serology. We can't use the DFA method anymore. In late syphilis or the tertiary syphilis, we can have some complications that could involve other organs. Some complications that arise in syphilis: central nervous system involvement, cardiovascular abnormalities, and tumors. Some asymptomatic central nervous system diseases with abnormalities in the spinal fluid but no symptoms. Some symptomatic disease in the late phase of syphilis. We can have some cranial nerve damage, some neurons in the spinal cord can be involved, leading to paralysis or a slapping gait. We can have deformed knees. We can have a cardiovascular syphilis where it targets the heart, and we may have an aortic or an aneurysm. Very rare, but it could happen. It just depends on where the Treponema pallidum deposits once it disseminates. The most important thing probably is the congenital syphilis. So we screen all of the newborns for syphilis in order to avoid this disease. So a lot of different symptoms here. We're not going to go into depth about that. But the main thing we want to focus on here is detection. So we've got the non-treponemal tests, which are your screening tests, and then we have your confirmatory tests, which are your treponemal tests. So the VDRL and the RPR are the two different non-treponemal tests. And the VDRL is a cardiolipin antigen that's mixed with the patient's serum or spinal fluid, and the RPR is a black carbon molecule that is laced with cardiolipin, and that is mixed with the patient's serum. So in both of these methods, you're detecting an antibody that is produced that binds cardiolipin. It's not a specific test, but it is very sensitive. So you do have a lot of false positives, especially if the patient has autoimmune diseases. So if a person has a positive screening test, the next thing you got to do is a confirmatory test. So these methods are used to detect antibodies that are specific for the Treponema organism. So FTA absorbed and the microhemagglutination test are used to detect antibodies that are created against the treponema organism itself, not as opposed to the RPR and VDRL, which is an anti-cardiolipin antibody. This is an anti-treponemal antibody. Very specific, less sensitive.